if I could get Kevin MD a wand and say, hey, you can remake the healthcare system however you want to, what would be kind of an ideal scenario that you think would be good for the healthcare system?
Yeah, that's
And
kind of a huge question. Yeah.
yeah, it really is.
So I think that I think smarter minds than mine have certainly tried to tackle that question. I think that there's just so much inertia in terms of what we have already with our healthcare system, right? We have this employer-based healthcare insurance, right? Medicare and Medicaid. We have private insurers, right? So I think it's very difficult. There's just so many entrenched interests in our healthcare system. So those who say, "Oh, we should just scrap it all and do something like a single payer healthcare system," I think that realistically would be difficult. I think that sometimes if you start from scratch, that certainly would be one option, but we're not starting from scratch. We're starting from an area where we literally have billions to trillions of dollars entrenched in the current system that we have. So there's going to be a lot of resistance to any major change. So then you have to look at other countries that have our similar values and have a similar basis for healthcare. So, you could look at countries like Switzerland that have private insurers that are highly regulated. That's what the Affordable Care Act try to better regulate private insurance. So that's certainly one option. Another consideration is to have basic government provided healthcare insurance. Some people say Medicaid for all, perhaps, or Medicare for all. To have some type of basic healthcare insurance, and then people who want can pay more and get some private insurance on top of that. I like Australia's healthcare system, where Australia, for instance, they have government provided baseline healthcare insurance. But if you want, to skip the line, and if you want something on top of that, then you can have private health insurance on top of that. But I do think that we do need at least some universal basic health care insurance for everybody in this country. That needs to be the start. I know the Affordable Care Act tried to do that, but we still have tens of millions of people who are without insurance. So finding a way to cover those, and then better regulating the private insurers and trying to improve what we already have probably would be the most realistic way going forward.